Hello everyone, Namaskar. This is Positive Talks with Shraddha, and you are watching special session on women's health. Today we are going to take a very important topic after the pregnancy, which is the postpartum. We have a very special guest from India, Ayurveda Charya Tanima Singhal ji. Tanima ji is a pregnancy educator and lactation expert. She has a very nice clinic, Masi Care. So, a very warm welcome, Tanima Singhal ji, in Positive Talks with Shraddha.
Thank you, Shraddha ji, for inviting me here.
Tanimaji, since we are already discussed a lot before this recording, that how important is this postpartum period and what are the causes of these kind of complications and how to deal with it. So, first of all, I really want to know from you for my viewers that how it's changed our life. Once we are pregnant, we dream a lot about the baby, and after the baby, the very nice motherhood life and all. But after delivering the baby, it's not that same we thought about.
Yes, Shraddha ji. So I agree with you. One thing which every mother, every lady, in fact, wants becoming a mother is a dream for most of the women, and pregnancy and all that has lot of. She's just making a story around her. She's having a dream world that her baby will be there. She will be holding the baby in her arms, and that will be a cakewalk. And right now when we speak about postpartum, then obviously
Mhm.
every one of us has a thing that something is not like right with postpartum. We
Yeah.
have in our everyone's mind. And
Mhm.
why is it so? It is
Mhm.
because the mothers are not given that kind of knowledge about postpartum
I
during their
see.
pregnancy period itself. They
Mhm.
should be aware about what is coming for them
Mhm.
after delivery.
Mhm.
Once they are mentally and physically prepared, it will
Mhm.
be easy for them to embrace the things which are happening during postpartum.
Yeah.
Everybody is telling them that everywhere she can see the beautiful photographs having a baby in the hand.
Yeah.
So this works like this, that we should have a proper system where a mother is already like she has a good knowledge about it, and
Mhm.
after delivery there should be a proper support system to help her cope up with the hormonal changes and the postpartum rages.
So let's talk about them one by one.
So this is a beautiful slide to tell about so many things which happen after the baby is born. But I would recommend every lady to watch these things even during their pregnancy and not to be afraid of them.
Mhm.
You should embrace it and understand about it. So first thing, as we can see, is about body aches. And believe me, many times people think that it is because of the surgical intervention that the
Mhm.
body aches are happening,
Right.
whereas it is mostly because of the postural issues.
Hmm.
During pregnancy, our posture changes,
Hmm.
and that's why even after delivery, to feed the baby, the proper positioning is not taught to the mother.
Correct.
And that is the reason, because of the posture problems, that these body aches are happening. So
Hmm.
once we correct the posture, we tell the mother what is the correct positioning of feeding the baby, then this will not happen.
This causes the mood change, like easily irritation and the anger because the body is not calm. It's not like a normal body. It's anger and irritation after that. Is this so like connected with each other?
Imagine if it is a natural vaginal delivery, or also a surgical intervention. Both of the ways, there are physical tolls on the mother's body. So this will or anyhow will have issues related to body aches. And
Hmm.
posture gives a add-on on that. Obviously, it causes irritation. The mother feels fatigue. She has this irritation because of that. And
Hmm.
over issues, she's not used to the night wakings.
Right.
She's has to wake up in the night,
Yes.
because our normal circadian rhythm says sleep in the night, get up in the day. But the
Hmm.
baby doesn't know that.
Yes.
So we have to adjust according to the small baby.
Hmm.
And there comes not only the role of a mother, the role as a family. If the baby is keeping up in the night, we as the family should support the mother. It's okay. We should take turns. We
Hmm.
should try to help the mother into this. So, irritation and anger. And when those expectations are not fulfilled, we feel angry. So, these are what I feel of irritation or anger when we
Hmm.
talk about.
Yeah. Yeah. And the anxiety also, sometimes feeling like I'm useless, worthless, lonely, and all.
Loneliness. I always ask the mother, whenever you feel lonely in the night, remember there are lots of babies and the mothers who are waking up with you.
Yeah.
Maybe on
Very.
your own road, on your own, in your own colony, in your own building, there might be many other families.
Yes.
And as you are busy, even they might be busy to contact you. So just remember, there are mothers around you who are waking right now. And believe me, Shraddha this happened, this helped me also during my
Hmm.
postpartum period. Whenever I used to get up in the night, I used to remember. I used
Hmm.
to remember myself voluntary that there will be so many mothers who would be waking up right now.
Yes, yes.
And that helped me.
Yeah, consoling, psychologically. Okay, yeah, we are not alone. So, yeah, loneliness comes once we feel that everybody has gone to work, and if somebody is working. So, if I talk about Germany, like most of the people are working here. So, this is the break time for a mother. So, just cut down from the normal life and also from the society, and doing the same thing 24 hours. It's not that easy, I understand. So like, how to overcome with this feeling that now my life is going to be like this only, get stuck somewhere, or it is just a phase?
Yes, as you already told, it is a phase. This one thing has to be repeatedly explained to the mother. It is a phase. Look at your mother. Look at your fellow friends. Look at your sister. Look at your family members who are mothers. They are now okay, they are now enjoying their life. So it is okay when you
Yeah.
are seeing others and they are now, you feel that okay, they are not having these issues. It is
Mhm.
because that phase has passed, so it will obviously pass for you also.
Mhm. So you spoke about the lactation hormones, that these hormones are the main reason for these mixed feelings. So how does it work?
Okay, so pregnancy hormones and lactation hormones are very different. The
Mm-hmm.
lactation hormones are oxytocin and prolactin. And what happens, the prolactin, that is mostly like it has a peak value between 12 a.m. to 5 a.m.
Mm-hmm.
The nature has planned that way that if the baby gets up in the night, the baby feeds. And
Mm.
when the baby breastfeeds, there is more demand by the mother's body. And that way, when there is more demand, the mother will make more supply.
Mm.
And when we disrupt this natural cycle, then
Mm-hmm.
comes the issues like low milk supply or the baby is not having any kind of milk.
Mm.
And as the picture itself says, then comes all these things in the picture,
Yeah,
which
yeah.
we don't want. We want to
Yeah.
avoid them.
So in any case, like it's not in our hand. We don't know that how our body is going to react after the baby birth. So some people are not that capable to just go with the mother feed, and so has to take the external help. So is this normal? Because then the guilt feeling comes in mind.
For this, I'll say one thing, that first of all, mother should have confidence on herself. She
Mhm.
should trust her body. If your body can nurture your baby during pregnancy, why not now? First
Wow.
thing, you should take that kind of trust on yourself. Trust your body. Why not? And then try to work out what are the things which I am lacking right now. Think
Mm-hmm.
about it. And you can do that when you are peaceful. Then only you will be in the taking phase.
Mm-hmm.
Try to learn them, try to follow them,
Mm-hmm.
and then you will find out, okay, what are the reasons. You work on them with an expert, get a help from guidance from the expert, and get the things resolved if you are not able to handle them by yourself.
Mm-hmm.
And then if you have tried everything and nothing is working for you, then I'll say it's okay. It's okay. There you can come again on this phase.
Mhm.
Sometimes, mothers, they feel so low at that time, they just want to give up.
Yeah.
And even giving up is not a choice for them sometimes.
Hmm.
So I ask, many times it happens that I ask the mother to take a break for few days. It's okay. Be kind and gentle on yourself. We'll again work it out. And that's the reason is, that's the most important thing of accepting
Oh,
yourself.
so how to take a break? Like it's a 24 hours responsibility. No?
Okay, so what I say in this is that she can have the turns in this. Okay, so she has a family who can
Mhm.
be helping into this. She can feed the baby, but other times she can take rest and somebody can take care of the baby. So
But
she'll have some time in between.
in Germany, it's not possible because most of the time, like family cannot come here for the help. So the couple has to handle the whole thing, cooking, cleaning, because we don't have a household help here normally as we have in our home country. So this situation is really, become very weird and hard to handle for one.
Okay, so for this, I will say that the night sleep is very important. Day sleep can be managed, but the night sleep is very important. So, what there as a couple, what people can do in the night, the mother can feed the baby, and the husband father can take care of the child. And in
Mhm.
the daytime, the mother can do the other household works also, because usually babies are more sleepy in the day. They usually get up in the night, but they mostly sleep in the day. So at that time, other things can be worked out into this.
Okay, but after a paternal leave, father has to join the office also. Maybe it's a work from home, but yes, if he's waking up in the night, like he might feeling the same thing, like having a
So it
fatigue
is the
problem.
same for the mother also. She has to
Mm.
also work in the day. It is a teamwork. Parenting, when we say parent, it means both father and the mother. So this is a role where both the parents have to take part. Now, I can suggest that if he makes a plan there, that the mother can feed the child and the baby can be taken care in shifts, you can also do. Then the first half can be taken care by the father, and the second half can be taken care by the mother. And in the early mornings, the babies usually sleep around 5:36. Usually the babies sleep at that time. So that time mother can take a little like bigger there. She can sleep for a longer time, and the husband can go by himself. Like she doesn't have to get up and make breakfast for the father there for few days.
Mhm.
Manage for
Mhm.
few days, because once the postpartum, and especially first 6 weeks are more important. So
Mhm.
that phase, when we say first 6 weeks, that is the most crucial phase. Once that 6 weeks phase is passed on, then the things will start falling in their places by themselves. So just hold on for first 6 weeks.
So, Tanibaji, can you suggest something like some food supplements which we can take in our regular diet and postpartum, period can be easy for the new moms?
Okay. So as our Indian nutrition and our Ayurveda says, we have to balance the three doshas like Vat, Pitta and Kapha. Now
Mhm.
it depends on what is the mother having her Prakriti. If it is a Vatash Prakriti, we
Mhm.
give mostly the cough inducing foods.
Mhm.
So in Ayurveda, we say about Urad, and
Okay.
Urad dal is supposed to be cough increasing food.
Okay.
Okay, so she can have like khichdi. We
Mhm.
always call at as khichdi as the best diet for a mother.
Okay.
So starting she can do with yavagu. Yavagu
Mhm.
is moong dal khichdi,
Okay.
and slowly she can go for mash, which is this one,
Okay.
urad dal, which I'm telling.
Nice. These are the
Also, she
stages to use the
yes,
pulses. Okay.
correct,
Mm.
correct. So you have to start with the simple carbs and go for the complex carbs.
Mm.
Why complex carbs? Because they keep you full for a longer time.
Yes.
Simple carbs, they give you instant energy, and you want both. Also, mother should have a proper protein diet. The
Mm-hmm.
protein diet will help in her lot of like topical things also, her
Mm-hmm.
hair loss, her skin texture, her milk
Mhm.
supply,
Mhm.
everything, her healing in
Mhm.
a better way.
Mhm.
So, what are the protein sources? There are your milk and milk products. For non vegetarians, it is the easiest way because all the non veg foods are very rich in proteins.
Mhm.
For vegetarians, soya bean is a very good thing for having protein with less carbs.
Mhm.
Otherwise, all the dals, pulses, they are
Mhm.
very good in protein. Also, the whole foods. So, like all the cereals which are available, but in the whole form, like whole wheat, where a whole wheat flour, if it is
Mhm.
available, then the mother should try to have chapatis with that, like
Mhm.
whole made with whole food, whole wheat.
Mhm.
Also, the rice and all that, the brown rice, they have that has more fiber in it.
Okay.
the,
Yeah.
the nutrition value is not different, but that has more fiber. That is the
Mhm.
only difference with there. So it
Mhm.
has more fiber and it keeps the mother full for a longer time.
Mhm.
Okay, next thing, you can have more of seeds. Seeds are very good, not
Yeah.
only for protein and something, and
Mhm.
usually we are not used to of having seeds. So I
Yeah.
recommend having lots of seeds, different
Mhm.
seeds. You can have them as snacks also,
Mhm.
because to have a proper meal sometimes it becomes a challenge even to have a proper meal.
Mhm.
Also seeds around that, nuts. So
Mhm.
a proper nut and seeds like she can have in the snack form there.
Okay.
Okay.
Mhm.
Then we talk about fats. Then fats are not bad, they're not bad. You should
Okay.
never try to like that. So having like ghee, in Indian tradition we give lot of ghee to our.
Yes. Is this good?
So
Like, it was my question to you after that. I thought that I will ask you after that, but please answer me now.
what I always ask the mothers or anybody,
Mm.
see your gut system, how much it
Mhm.
is digesting. If you
Okay.
are able to digest a certain amount of ghee in your diet,
Mm.
why do you fear that?
Mm.
Have it.
Mhm.
Now mothers fear of how will they lose their postpartum weight.
Mhm.
Nature has taken care of that. A breastfeeding mother loses around 500 calories per day, which is equivalent to working out in a gym for 1 hour, one and a
Okay.
half hour.
Okay.
So that you,
Nice.
when you are breastfeeding your child, you are already losing the calories. So you should build up your protein mass.
Mhm.
Otherwise, you will become lean and your protein will go away. You will lose weight, but
Mhm.
again it will come back. And many times mothers say that I lost weight during my breastfeeding journey, but again I regained that weight. It is
Mhm.
because you lost the protein that time.
Mhm.
And for that you should have a protein rich diet, which will help you to increase your breast milk also, and also to increase your protein mass, which is important. You
Mhm.
should like your fat should go away. And you know the beauty of fat loss is by having fat rich diet that helps in liposis.
Mhm.
So that is very helpful there.
Okay. So, is there any right proportion to take the ghee or maybe protein every day in a meal, or maybe different
Okay,
times?
so for fats, there is no particular, if I say, because it depends on the prakriti of the mother. If
Okay.
she's a Vatash prakriti, she can have more ghee. But if she's
Mm-hmm.
a Kafash prakriti, she has to take less ghee. There.
Mm-hmm.
Now,
Mm-hmm.
talking about protein, the protein has a very good marker that we should always calculate 1 gram per kg weight
Mm-hmm.
accordingly. So, if
Okay.
she can calculate according to her body weight, she can have that much of proteins
Mm-hmm.
safely. No issues with
Mm-hmm.
that.
Mm-hmm. What are the vegetables helpful to take in this time?
Okay, so usually we in Ayurveda called as badi. The badi
Mm-hmm.
vegetables are not advisable for a sutika, which we
Okay.
saw call as new mother. So we
Okay.
usually avoid like this. If you eggplant, the bangan which we said brinjal,
Okay.
eggplant
Okay.
it is called as.
Okay.
We
Mm-hmm.
usually avoid that, but you
Mm-hmm.
can have more of greens. Greens are full of vitamins and minerals. So
Mm-hmm.
greens, any kind of greens, you have to
Okay.
see around you. Whatever is green is good for you. You can have that. So this
Okay.
is one thumb rule, and also have a rainbow diet. Rainbow diet is having different colors of vegetables in your diet.
Okay.
If you have difficulty to do per day, you can even divide your days. That Monday
Mm-hmm.
you can keep a red day, that day you can
Okay.
have more tomatoes, and that way. So Tuesday can be a yellow day, you can have pumpkin, you can have more lemons in your diet, that way. So this way you can plan your day if you feel that. And all this planning should be done during pregnancy. After delivery you won't have that much time to work on this.
these things during the pregnancy as well. And since you are saying that to start it in the pregnancy time, so it would be become the habit of a
Yes,
mother,
yes.
or no, would be mother and the new mother. Nice. So we haven't discussed the fruits, like, and also the eating salad, like green thing in a raw form is better, or the cooked form in this time.
Now, there are different views on this. Some
Mm-hmm.
people say that eating raw vegetables is not good. Some say it is okay. Some say mixing of raw and cooked food should not be there. So,
Okay.
I always say that what you do, you take salad, because in the beginning of your food, and especially for a new mother, she will have difficulty to have proper meals at
Mm-hmm.
one go. So,
Mm-hmm.
it is better she can split her meals.
Mm-hmm.
As during pregnancy, we advise the mother to have small, frequent meals. She can continue even after delivery that way. So, suppose she has salads in the mid afternoon, then she can have her lunch at her regular time.
Okay.
So, this way, we are not disrupting we are not offending anyone, whoever has different views with that. And it is
Okay.
helpful for the mother for a regular energy flow which she wants.
Yes, yes. And what about the fruits? Like how to include fruits wisely in this time?
First of all, I'll say that never go for fruit juices. Always go for whole fruits. Many
Okay.
times people think that having juices will help.
Mm-hmm.
Having the whole fruit will add the fiber.
Mm-hmm.
Also, try to have fruits in the daytime. In the night or in the evening, it is kapvardak. So have
Okay.
it in the daytime.
Mm.
It will be good if you can have in during your breakfast time. So
Mm-hmm.
if you are having breakfast early, because obviously you have got up in the night, so you'd be tired and exhausted, having a nice two bananas in the early morning, it's so
Mm-hmm.
good. Have it, it is refreshing.
Okay.
Start your day with that.
Nice. Okay, very nice. So let's talk about some, like, it has just come in my mind. So I'm just asking that there are some myths in mind that if you'll drink lots of milk, then you will produce lots of milk for your baby.
Yes,
Is this
yes.
true?
No, it is not true.
Okay.
Milk will not make milk. Okay. So what?
Mm-hmm.
The most important thing, seeing first of all, this is a myth. Sometimes if your gut system allows you to have that much of milk, it is okay. But don't force yourself because you have to drink milk.
Okay. Okay. So during the feeding baby, like, is this normal if someone is feeling thirsty all the time whenever it happens?
Of course, 3 liters of water is the must for a new mother.
Mm.
Hydration, this is so important.
Mm-hmm.
Imagine what, like milk. What is the carrier of milk? Water. The
Water.
body puts in nutrition into the water and make
Mm.
it as a milk. And if
Mm.
the mother is not having sufficient water for herself, the
Mm.
water she's having will be used for her own body,
Right.
because that is the self defense of her own body. It will
Mm-hmm.
use up that water. And if she's not hydrating well, the supply might go low there,
Mm-hmm.
because obviously she needs more water. And hydration will keep her more energetic, it will
Mm-hmm.
keep her cells supple.
Mm-hmm.
So, all these things are very important.
All right. So, what I understood by this session, that if somebody is taking care of well with the, family support, or maybe the organizing the day according to the new responsibility, see the other moms also, those are going through with such kind of challenges, would definitely help emotionally and psychologically. And it is very important to keep the body fit by drinking water or eating right food in a right time, knowing your body, like vata, kapha, pitta. We will definitely talk about these types so that the viewers can understand that in which category their body actually falls in. So would be really helpful for them. And the other thing, like, watch such kind of motivational
I was
channels.
just going to say that. I was just
Listen
going
to
to
you.
say that. and also keep watching Positive Talks with Shraddha.
Yeah, and especially like the way you explained everything, it's not that big as any new mom thinks about it, because it is just a phase which is passing through, and then our life will be get normal again. So I really like the name of your clinic. It's a Masi Care. I told you before also, because this time
Yes.
care means a lot to a person. And I would request you to please keep coming in our shows. And I hope the viewers would definitely like this session with you. And thanks a lot for coming and discussing and giving the right way to follow to the new moms. Namaskar.
Thank you so much, Shraddha ji, for inviting me.